It's about time. It's about time injured 9/11 responders got help.
For the first few days, the only respiratory protection they gave us was paper masks.
We were told the air quality was fine.
That it was healthy, that there were no toxins to worry about.
That was the first day I had the cough. It never went away since.
Because your eyes were burning, even with the protection.
Everything was dust, which was toxic.
In the years after 9/11, Washington refused to respond to the health crisis facing so many. 33,000 Americans are currently sick with 9/11 related illnesses.
After 9/11, we have had a dramatic increase in cancers, an increase in the severity of those cancers, and in a younger patient population.
4,000 responders and survivors have been diagnosed with 9/11 related cancers so far. By December 2010, Congress had still failed to act.
This was the most deadly terrorist attack in the history of America. And now, 9 years later, this body cannot come together to do what's right.
Also stalled a bill to provide health benefits for 9/11 first responders.
A lot of the things they're saying is, hey man, it's Christmas. And I want you to listen to this. They're saying that they don't have time to get to this. It's an absolute travesty.
The time to pass the James Zadroga 9/11 Health and Compensation Act is now.
On December 22, 2010, Congress finally passes the Zadroga Act.
Well, this is the day we've all been working towards and waiting for. Our Christmas miracle has arrived.
However, Congress had the Zadroga Act set to expire in 2015. But by 2015, more than 110 firefighters had died of their 9/11 illnesses.
Today launches our campaign to make the bill permanent, the Zadroga bill permanent. We cannot fail.
We must not turn our backs on them now. We must reauthorize these programs.
The fight was just beginning.
You absolutely have to be down here telling the story.
They are now paying the price with their health and with their lives.
These guys are a 5-year program, right? They get it right. These guys have stage 4 cancer.
It is absolutely unacceptable to turn a blind eye to the thousands of men and women who were there for us on 9/11 and who are now quietly suffering every day. But today they are not quiet. Today they are meeting with the leaders in the House and the Senate.
We've got the commitment from the Speaker that it will pass. Again, if someone's prohibited, the commitment doesn't count.
The clock is ticking. 23 New York City police officers perished on that day. Since that time, we have lost another 115.
Here we are 5 years later. And unfortunately, the 5 years later, because that first bill came with an expiration date. But the illnesses that our members were dealing with didn't have an expiration date.
December 15, 2015, the Zadroga Act extension bill passes Congress, making the WTC health program permanent, and the Victim Compensation Fund receives $4.6 billion more to fully pay claims.
Today is a joyous moment for the people here, a day I didn't really believe could actually ever come, and it has.
I think it is a proud moment for our country. It really shows what a great nation can do when everyone comes together.
I think that message from Congress is if you do the right thing, we'll take care of you and your families, and that's a victory for this country.
It's great news. It's great news for all 9/11 responders.
Today we passed a bill in both houses that gives certainty that we will provide health care for those rescue workers forever.
Although we celebrate a victory for continued health care, the compensation fund for 9/11 victims expires in 2020. Citizens for the Extension of the James Zadroga Act, Inc. worked with a coalition of unions and advocates to help pass the extension. 72,000 rescue workers living in all 50 states are being medically monitored for 9/11 related illnesses, including uniformed and non-uniformed responders, construction workers, residents, and federal, state, and local government employees. 9/11 Health Watch will be making sure the programs created by Zadroga are working. For the sick and those who become sick in the decades to come, it's about time. We must never let the clock run out again.